Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. The information is not to be interpreted as or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, or treatment.
Hi there, and welcome to today's episode of the Dutch Podcast. I am so excited for you to join me on today's episode. I've actually been wanting to talk to this guest for quite a long time. She has really become famous for kind of coining the term, the period's a vital sign. In fact, she's written a book called Fix Your Periods, and really has changed the game when it comes to women understanding the fact that the menstrual cycle is something that is a really important data point for us to understand what's going on hormonally in our body. On today's episode, we talk about that really across all age spans. You know, what is normal for a menstrual cycle in a period? What's abnormal? What happens to women? I'm sure a lot of you listening have been in this situation where maybe you were told that heavy bleeding or period pain or spotting or all the other things that you're dealing with your period are fine and you just have to live with it. She's really been a big advocate publicly to get us to look at this a different way and really to inform women how you can talk with your healthcare provider about what's going on with your period and how to actually improve it. We talk about perimenopause and all the changes that happen with the menstrual cycles, many of which are normal and can be uncomfortable. And then we also talk about what it's like to try to get pregnant during this age and also to be pregnant during the time in perimenopause. We cover menstrual cycle across the whole life cycle, and I'm so grateful for the time that our guest spent with us today. My guest today, as you've probably figured out, is Nicole Jardim. She's a certified women's health coach and the author, like I said, of Fix Your Period, a practical guide to naturally balancing hormones. She's really become known as the period fixer because she's helped thousands of women better understand their menstrual health through her approachable, science-backed methods. Nicole is also the founder of the Institute for Menstrual Health, and through its signature program, the Women's Hormone Health Certification, she teaches other healthcare practitioners and coaches the fundamentals of hormones, menstrual cycles, and fertility. I'm really excited to dive in. Well, Nicole, welcome. I'm so glad to have you on the Dutch Podcast today.
Hi, Jacqueline. Thank you so much for having me. I'm thrilled to be here.
So I always love to start by just asking a little bit about your backstory for our listeners. I don't even know your backstory, and I've read your book, but I'd love to know more about what made you so passionate about periods.
Oh, where do I begin? I feel like we have all day. It's a whole podcast episode. It really actually was not at all planned. I had terrible period problems as a teenager, and those just got progressively worse as I got older into my late teens. And I finally went and saw my mom's gynecologist, and she pretty much immediately put me on the pill without asking really any questions at all. Just wanted to know what my symptoms were, and that was it. And I was thrilled, as you can imagine, because everyone else was on the pill, and I thought I was the only one out or left out of not being on the pill in the cool girls club. And so I went on the pill, and I feel like I went from having all of these horrible symptoms with my period to having all of these other what felt to be seemingly unrelated symptoms with regard to what was, my whole body. So I was suddenly having UTIs and yeast infections, and I was getting headaches, and I was having joint pain, and I developed melasma all over my face. And I remember a doctor telling me, well, that only happens in pregnant women. So I'm not sure what's going on with you. And, there was a lot of those kinds of things. I had horrible gut issues, immune system problems. I was always sick. And no one could tell me anything. I went to probably 12, 13, 14 doctors. And
Wow.
I saw all kinds of doctors. I went to a GI doctor. I had a colonoscopy because they thought maybe I had Crohn's because of all of my symptoms. And I went to dermatologists. My OBGYN was a revolving door. And I really got no answers. And I actually ended up having an allergic reaction to a UTI medication, to an antibiotic. And I ended up in the ER. And, bright red, 104-degree fever, just great. And that was really what led me to seeing an acupuncturist. A friend of mine was like, are you going to see this acupuncturist finally or not? So that's how it all started. And that really put me on this trajectory. He was the first person to ever say, it could be the pill that's causing a lot of your problems. And I didn't really believe him because no one had said anything like that to me before. So that's really where, that's really where it all started. And here we are 20 something years later. And
yeah, it's amazing that you could have had so much struggle and gone so long before someone looked at the medications that you were on.
Yes, I know. I thought the same thing. And this is what I hear still repeatedly from women. So that's essentially how I got to doing the work that I do. And I became very passionate about it because I had struggled so much. And I thought, well, if I could just help one woman not go through what I went through, and here we are.
Totally. It's interesting because the pill can be such a beautiful, wonderful option for so many women for so many different conditions. And it's also not right for everyone. And, I have just a similar story background, which I don't think I've ever shared on the podcast, where I just never got my period. I had like primary amenorrhea, and I did a progesterone withdrawal challenge and I bled. And so they put me on the pill before I'd even had a period. And it wasn't until I was probably in my mid-20s that I was like, well, what about if I ever want to have kids? And they said, well, don't worry, there's other drugs we can put you on for that. And that's what actually turned my trajectory from conventional to naturopathic medicine, because I just saw a gap in wanting to know what was wrong. What it's like, this is something that should be happening. That's not happening. And you can give me a pill to mimic it. Of course, we know that's not a real period. It's a withdrawal bleed. But then don't you want to know what is going wrong? And so I love your whole concept of fix your period, because the period is such an important thing. It's an important metric and sign for our body that our hormones are doing what they should be doing.
I would like to believe that. Yes.
So I want to start by just talking a little bit about what are the most common abnormalities that you see or that people talk to you about in their period?
Would you say in your 30s or your 40s? Because
let's start with 30s, like primary productive years, 20s and 30s.
Yes. I would say that one of the biggest things that I see is heavy bleeding. And this is just one of those issues that is so pervasive, and yet it's so just dismissed. I can't get over how normalized heavy flooding bleeding is. And it's something that I find typically shows up in the 30s. I mean, it's a problem in your teens and 20s, no doubt, especially the teens where your whole endocrine system is sort of reorganizing and trying to figure things out. But in your 30s, when you've been pregnant, you're in postpartum, there's so many changes and fluctuations that it tends to show up a lot. And like I said, I see that a lot. And what I'm saying when I say heavy bleeding is so anything over 80 milliliters of blood loss. And some women look at me and think, what? Because I'm losing 200 is what it feels like. Mm-hmm. And I tell them, you're looking at 5 to 7 pads or tampons per period. And they say to me things like, you mean per day? So this is clearly a very common thing, I think, and something that I think really needs to be addressed more. So that is one of the things. I would say the other thing is period pain, another condition that is so over normalized, and I will never get over that there's so little investigation into this issue. And so I tell women, if you're taking more than 2 ibuprofen per period, not per hour, not per day, then you should be looking into what is causing that pain and discomfort. If your period pain is disrupting your life, there is something going on and you need to look into that. So those are 2 things. I would say cycle irregularities as well. The amount of women who have said to me over the years, I just thought I was pregnant again this cycle because my period didn't come, because they have no idea when they're ovulating. They don't understand what these changes or, what is happening during that ovulatory window. And they don't understand that within about 14 days after you ovulate, you should get a period. So they have 35-day, 40-day cycles. And so ovulation is clearly delayed or it's not happening for various reasons. And they are struggling thinking that maybe they're pregnant. So those are some of the major ones. And then, of course, the mood issues as well. So I feel like in the last decade, particularly, I've noticed a massive heightening of mood-related issues in the lead up to your period. And I just think that is sort of a reflection of our declining sex hormones, our declining progesterone as a whole. Like our quality of ovulation is just not what I think it used to be. And I just think that is reflective of our overall health in general. I'm not going to say that this is the case for every single person by any means, but I do see a pattern for sure.
Yeah, I mean, my whole practice life was around fertility, and this is why we see more and more people struggle. We don't look enough at cellular health of the ovary and of the sperm, right? The sperm and the egg and the sperm. But within the ovary itself, I think we even overlook that while we focus on egg quality and not ovarian health, because the ovaries are also where we make our sex hormones. And when you think about, I always think about this because a lot of naturopaths with women go have low progesterone, they put them on progesterone. And it's like, you can do that, but that's also a Band-Aid fix. You have to ask, why is the corpus luteum not making enough progesterone? And usually that cycles back to poor ovarian health. And you've got to work on mitochondrial health and some of those foundational pieces that are so critical.
I couldn't agree with you more. I know, exactly. I had someone say to me recently, and I feel like this will tie into the conversation we're going to have as well about 40s and whatnot, but she's doing physiological dosing or rhythmic dosing of hormones. And she was saying, well, I don't have perimenopause and I'm 60 and I'm not in menopause because I'm getting a period every month. And I was like, but you are not ovulating every month. Mm-hmm. And she just thought it was that perimenopause and menopause was the cessation of a period. And I said, no. There's a whole lot going on underneath that. And so I think that there has been way too much emphasis on our periods versus what is driving your actual menstrual cycle.
That's such a great point to make. And I love the clarification because I think, some people don't know, and listeners and even practitioners. I mean, you teach practitioners, I teach practitioners, the awareness of the fact that like on an OCP or on physiologic bioidentical hormone dosing, the bleed is not a menstrual period. It's a withdrawal bleed from the hormone. And when things are normal on hormone therapy, it doesn't necessarily mean that they would be without it. Well, maybe talk us through like what should women experience if they're at their reproductive prime and their menstrual cycle is healthy. What should they experience with like how much bleeding, how much pain, the timing, all that stuff? What would normal look like? Like what's our goal?
Yes, I know, right? Period goals. I would say that in terms of the length of your period, I like to see a period somewhere between 3 and 5 days, ideally, although 3 and 7 days is considered acceptable. In fact, from conventional medical norms, 2 to 7 days is considered acceptable. Although I find that 2 days or less just means to me that ovulation might not be happening or estradiol is just not building the lining to where it needs to be. So somewhere between 3 and 5 days is what I consider to be the ideal length of a period. And then in terms of what it looks like, you really want to see that brighter red or that more vibrant red blood color throughout the majority of your period. Sometimes periods start with a little bit of brown blood, and that's typically left over from the previous cycle. So that I think that's okay, depending on what the whole context of your period looks like. I always say to women, don't focus on one tiny symptom. You have to look at it as a whole. And I think that that's a big issue, that we just hyper focus on something like spotting, a day before our period and completely freak out. And I don't want anyone to ever do that. So that is something as well. So your period blood color. I also had someone tell me, what if my period looks like blueberry jam or, it's all like chunky. And I'm like, girl, that is not something that you should be aiming for. So we're really wanting to have flowy, I say like maple syrup, so many food, references here. It's kind of gross, but it's kind of how it works. It's what we relate to. And so I say, you just want it to flow for the most part. Yes, there can be a few clots. You really don't want them to be more than like an inch long or wide. And yes, they should just not interrupt the flow of your period. So that's something too. And then, like I said, the color, the texture, how much you're bleeding, as we were talking about. If you're changing tampons or pads or your period underwear, like every 1 to 2 hours, very consistently throughout your cycle, that to me indicates something is going on. And we should look at that. And other signs as well are if your period really wipes you out, or if you are changing at night, once or twice at night, you're getting up, or you're doubling up, or you're just completely panicked about leaving the house and you feel like you flood through your period protection quicker than an hour or two, like I was saying, those are all signs to me that you probably have a heavier than normal period. And then on the flip side of that, the light periods too are a real thing, as well as we were talking about this ovarian health that is diminishing generally is what it feels like. That is a sign too that ovulation maybe didn't happen and your hormones just aren't where they're supposed to be to give you that, that longer, more robust period. If your period is like pink colored or just very light, watery, stringy, those are signs that there's something potentially going on there too. And then with the pain, as we mentioned, you really don't want to have pain that disrupts your life. I think like some cramping, things like that, that's not too crazy. But when you can't leave the house or go to school or work, or it's just totally disrupting your day, then that to me tells me that there are underlying issues happening. And I think the other thing too that's often overlooked is ovulatory symptoms, ovulatory pain, pain that feels worse than period cramps, which I hear a lot from women these days, or other ovulation symptoms where you just are really not feeling great at all. You have a lot of what we think in many cases are histamine overload issues because estrogen and histamine have this symbiotic relationship. So if you're having symptoms at ovulation, that's a sign too that something is up. So I would say that, those you're looking for those parameters. So you're looking for that blood flow, the length of your cycle, how much you're bleeding, how little you're bleeding, as well as the symptoms before your period. Like you really shouldn't be spotting more than a day or two before your period. And then those mood symptoms, if those are, causing you to maybe want to be divorced every month, we should definitely be looking at that too. So you should stay relatively calm. Of course, our moods change, but they shouldn't change that much that, like I said, you're ready to part ways with your partner or something like that.
Yeah. I mean, we have, like, you have a greater understanding for why the red tent existed back in the day,
Right?
where women would just come and menstruate together. And who knows what that conversation was like. Wouldn't you love to be a fly on the wall?
I can
Because
only
it separated
imagine.
them from their, partners, children, duties, just to menstruate and get it all over with before they returned.
I think that it really should be brought back personally.
I couldn't agree more. So, and I do think one thing that's interesting with mood is that you have like hormonal change during the time, and also you have neurotransmitters responding to hormone change. And we know now that even in women who have normal balanced hormones, they can experience PMS and PMDD because the reaction with their neurotransmitters, serotonin, dopamine, et cetera, the reaction from a brain perspective is different for women than it is for a woman who doesn't experience that. So I always like to call that out because PMS and PMDD, they're not always problems with your hormones.
I totally agree with that. And there are so many underlying pieces, right? When we think about inflammation and what is how that's driving the symptoms, or blood sugar imbalance. I often joke, I know it's not really a joke, but are you hangry or are you experiencing PMS? And we know this, that there are underlying mechanisms with blood sugar imbalance in the second half of the cycle. And so I totally agree with you too. The GABA allopregnanolone piece of PMDD is really important to consider as well. And this is why paying attention to your symptoms as an individual are so crucial, because no one's going to know your body better than you, ultimately.
Definitely.
Yeah.
So let's talk a little bit about perimenopause. I mean, it feels a little bit unfair that women, girls go through puberty and then you have to kind of go through it in reverse in perimenopause. Tell me a little bit about, what do women notice when they hit their 40s, like as they're at the end of their reproductive years, and then they start to move into perimenopause, into menopause?
Yes, it's funny. I hear this so often, that my period has totally changed and I do not know what's going on, or my mood has just completely tanked and what is happening to me? And I think that this is normal in that it's because you're in your 40s and this is a transitional time hormonally. Your body is shifting from the reproductive years to the perimenopausal wind down years. So of course things are fluctuating dramatically. It's like you said, right? We're essentially going through puberty again. And so as we were talking about earlier, I think one of the most important overlooked things is that ovulation is becoming lower quality, for lack of a better way of saying it. And at this point in the menstrual life cycle, our egg reserve has diminished significantly. Not everyone, but that's the trajectory that we're on. Mm-hmm. And as a result, we are just not producing the levels of those sex hormones of estradiol, progesterone, testosterone that we used to. And so I think that that is changing things dramatically as well. And so one of the things I see most is the cycle length change. So women will notice, especially in the beginning, those shorter cycles. So maybe you've gone from 28 days or 30 days to 24 to 26 days. And as I mentioned, that's ovulation, just not as robust as it was. It becomes less consistent. So you'll notice 1 to 2 cycles, or maybe even more a year, where you're not actually ovulating, but you're still having that anovulatory bleed. And so you'll notice that they're occurring earlier in your cycle. Your luteal phase is shortening again because your ovulation just isn't as good as it used to be. And so you're noticing that. And then also too, I would say that a lot of women, kind of like me, I just have been going down, down, down kind of thing. So I've noticed that my cycles have just gotten a little bit longer. Like I never had the shortening of my cycles ever. They actually just started getting longer. And so I think that I want to mention that too, just in case that's what's happening to you. So you kind of just sort of skipped that whole shorter cycle piece. And then with the flow, that's another one that shifts big time, of course. I would say the most common thing is the heavier bleeding, the longer periods, spotting before and after your period. And this is due to that imbalance, again, that I was talking about, where estrogen is typically higher than progesterone, because that progesterone is really starting to dip because of that ovulatory quality and the less frequent ovulations. And so that is driving this estrogen dominance in the luteal phase. And so you're noticing a heavier bleed or a prolonged bleeding. And then, of course, as we talked about, the premenstrual symptoms, more irritability, anxiety, breast tenderness. I've had a few friends who say to me, I just feel so ragey. It's so true. Yeah, the sleep disturbances definitely don't help as well. And the other thing too, I think is the fatigue. So we're just not bouncing back the same way that we used to. Migraines become more abundant, worsening period pain, or even new onset cramps, even if you've never had them before. All of those seem to be what I hear about from my community most.
Yeah. I think the other piece of that drives it, because I think you're speaking to a lot of that change where you have like less robust progesterone secreted, right? Which is the shorter luteal phase and thing like that. It can be compounded even more so because once in a while you'll get a really good egg, right? And then you have like so much FSH, follicle stimulating hormone, because your body is used to getting kind of poor quality eggs out of the ovary, that the FSH goes up. That's one of the lab tests you can measure as you hit menopause. FSH will be very, very high. And of course, we measure it when we're trying to conceive, because we want it to be low to show that the ovaries are sensitive. But then once in a while, you get a good egg, and the amount of estrogen produced can be even more than it is during your reproductive height. So it can be so tricky with that estrogen progesterone balance. It can lead to so many symptoms.
Oh, yes, agreed. I know, right? The winding down is a rough road.
It's a rough road. The other thing that I think is worth touching on, and this is a little bit outside of, what we had kind of previously let out for this talk, is like the presence of new problems coming up, like fibroids, during this time. Can you speak a little bit to that? Because I think, like, how can women know, what is a fibroid? Maybe you can chat about that. But then how would women know, maybe I should get worked up because this could be more than just heavy bleeding of perimenopause?
Well, this is the thing that I feel so strongly about, and it's something that I've advocated for in my work for so many years, is that we have to track our cycles. We have to understand what is normal for us, because I'm saying all of this stuff, but this doesn't necessarily mean that it's your normal. And so
That's a great point.
Right? Yeah. And so I really want women to understand what the heck is going on under the hood with their bodies, because if you don't, you're going to just be beholden to whatever a doctor is telling you over your lifespan. And I just ultimately think that doesn't serve you in any way. So ultimately, I believe that we should be tracking our cycles. We should be tracking what's normal, especially in our 20s and 30s, so that when the 40s hit and things start to maybe go a little haywire, they don't go haywire for all of us, but so many of us develop this heavy bleeding. And so I'm thinking, okay, well, what is driving that? Do we need to test your hormones? I mean, we should regardless, and see what's going on there. And is that what's driving it? Or like you said, have you developed fibroids? Because of the vast majority of women in their lifespan will develop a fibroid. And so do you have a fibroid? Do you have something going on with your thyroid? What is happening there? And I feel it's almost like a rite of passage for women in their 40s in perimenopause to be prescribed thyroid medication. At least that's what I'm seeing so much of. And
It's so common,
right?
Yeah.
It is so common. And we're not even explaining to women or taking into account the fact that you're losing those critical sex hormones that actually support thyroid function and T3 production, conversion and T3 production. So it's crazy to me that we're not looking at the full picture. And that is where, I think really working with a practitioner who is so skilled in this and will look at every aspect of your health and what is underlying the symptoms that you're experiencing is so crucial. It's so critical.
Yeah, I love that you bring that up because I think a lot of women naturally, we compare our periods to one another's periods, right? What's happening for you? Oh, that's different. This is what's happening for me. And it can be misleading to compare yourself to a friend and then think there's something wrong because it's different. Because the range of normal is relatively broad with periods. So I love that you're emphasizing like the know yourself so that you can recognize that change. And I love the sense of ownership that gives to women, that you have the answers. You need to reflect on your past data, not necessarily looking outward, but looking inward.
Totally. I know, it's so true. We do compare ourselves. I agree. And then it leads us to just being dismissed or told, well, you should do this, or let's just wait and see, or this is not a big deal. When in your gut, I think we all already know, right? Yeah, exactly.
So how do you recommend women track their cycles? This kind of begs the question. Like so maybe someone who doesn't have any period problems, what should they be doing to kind of monitor? And then if you're suspicious that something's wrong or you want to pay greater attention, is there more that women could or should be doing?
Oh, yes. Oh, my goodness. Where do I even begin? I feel like
I know this is like a whole separate podcast episode, but let's touch upon it because I think that, we have such informed listeners. We want to hear it.
Yeah, totally. I feel the same way too. When I think back to when I first started tracking in my early 20s or in my mid 20s after coming off the pill, I was so terrified. And I do want to speak to that because so many of us have been on the pill for so long or on an IUD. So we've had that little crutch, whether it's for symptoms or birth control or both. And so when we are suddenly left without that little protection mechanism, we feel so exposed and it's terrifying. And so I do want to speak to that because I was that way. And I remember I had a wall calendar. That's how I was doing it. Very, very, bare bones. And we didn't have an
I was wondering where you were going to go there, what you were going to say to end that sentence.
Bare bones. Yeah.
Bare bones.
There were no iPhones back then. So this is what I was doing. And then the iPhone came out and they had this, again, very rudimentary ovulation cycle tracker. So I used that. And so I think that we can either do one of two things or we start low and then build up. And so what I would suggest is we start with tracking our period related symptoms. So again, how heavy is your flow or light? How many days are you bleeding? What does your period blood look like? What is the color? What is the consistency? What symptoms are you experiencing during your period or before or even after your period? Are you having spotting? What are your premenstrual, emotional, mental health symptoms like? These are all really good symptoms to track. What's ovulation feeling like? Is that good? Not so good? Those are amazing. And that can tell you so much. And then I move into more advanced tracking with a lot of my clients where we're looking at basal body temperature. We're looking at cervical fluid patterns. These all change quite dramatically in perimenopause. So when you have that data from the time you're in your 20s or 30s, or better yet, even in your teens, my goddaughter started tracking her cycle when she first got it. And I was so jealous. I wish I could have done that, but it's because it's just so cool to see the trajectory. But yeah, I would say that if you can then track your cervical fluid patterns, because your cervical fluid changes so dramatically, not only within the span of each cycle, but also over time. If you were to have an infection of some kind, you could pretty much tell immediately. And if you know your cervical fluid patterns well enough and you know what symptoms to look for, you could technically, you don't want to self-diagnose, but you could really know what it could be, generally speaking. And then the same with your basal temperature too. If it's high, a good, it's within a good window in that second half of your cycle, that usually indicates that you're producing progesterone robustly. All of these signs of your fertility, I think, are incredibly helpful for your whole menstrual life cycle of tracking, not only in your 20s and 30s to know your body, but then to be prepared for that perimenopause window.
Totally. I just a couple of notes on that. Like, I think that now that we have so many like tracking tools, like Oura Ring, even Apple Watch does basal body temperature now if you wear it overnight when you're sleeping. It's become so much easier to track and to see that, to really get a sense of that, at least of the timing of it, which is, I think, amazing. One thing, just as an aside, that I read, I'll find the article and make sure we post it in the show notes and send it over to you. But I was doing a little bit of a research update and looking at what was out there. And one of the articles I came across, which was like one of the most important articles this year in women's health, was that when they looked, it was a study done, I think out of Tennessee maybe, where they looked at all of the period trackers. And they did find that with apps and devices, almost 80% of them like lacked encryption, and the data wasn't secure. So I only say that because keep in mind, like in a changing landscape with, access to reproductive rights changing all over the country, I think it is important to think about where your data is stored and what you're giving. So maybe a good old fashioned thermometer in paper isn't a bad idea. It's boring, but it works.
I'm so boring. I agree with that completely. I say a lot of my clients will use paper and they really love it. They like to be old school, whereas a lot really love the convenience of an app. But I completely agree with you. You really want to make sure that you're checking the privacy policy of that app if you're using it, for
they
sure.
They could sell the data. There was so many different things named, but they could sell your data without consent or explicit consent, blah, blah, blah. All things we need to be aware of in our tech age across all of our healthcare data, right?
As if we aren't stressed enough.
I know, seriously. So that's great for that basic tracking. Can we talk a little bit about lab testing as well, and like what women should be thinking about for lab testing when it comes to assessing their cycle?
Yes, for sure. I usually do a combination of Dutch testing and blood testing because obviously, like you were talking about, we want to see what's going on with your FSH and your LH early in your cycle around day 3 to see what is happening with your brain's conversation with your ovaries. So I will do that, and I will run a basic blood panel on estradiol, some androgens, and then we'll look at progesterone as well on, the flip side of that after ovulation, 5 to 7 days post ovulation. And then we'll look at Dutch testing as well. And so I found that this can be incredibly helpful, particularly the cortisol and adrenal function testing.
I'm so glad you're bringing that up.
Oh, yes, because again, I just think, I make light of this, but I feel as though this is something that we really we're just not tuned into enough. And it's that we live in this age of chronic overstimulation. And so many of us don't even realize that stress and blood sugar and insulin dysregulation are the top-down drivers of almost all of our period-related problems. And more so in your 40s, because we become less resilient, sadly, to stress and blood sugar dysregulation. And so I find that the Dutch paints this amazing picture of adrenal output, and it really will flag those stress-driven hormone disruptions. And so that, to me, is invaluable. And I just had a client do a Dutch test for the first time. She's 41 now, and she can see on her Oura Ring every day there are a lot of spikes, and she's in that stress zone, but she doesn't totally know why. And so when we could see the full picture of the cortisol patterns, it made a lot more sense to her. And it was just great to help her then start to integrate more lifestyle tweaks, adaptogens, things like that.
Yeah. I just got my Dutch test back and I have some work to do on my own stress response for sure.
Don't we all?
But it is interesting to think about when we look at perimenopause specifically. I think one thing that's so fascinating is we go from an ovarian source of hormones to an adrenal source of hormones, where DHEA made by the adrenal gland becomes a major precursor for all of our reproductive hormones, estrogen predominantly. So, and of course, androgens. So it begs the question, how does adrenal function prepare us for, or balanced adrenal function prepare us for, or put us in a situation where we're going to experience a tougher transition in perimenopause? I think about that a lot.
Oh, I think about it so much too, especially when you're just thinking about progesterone and estradiol's role in our stress buffering. Essentially, as we were talking about earlier, we have that progesterone. It influences stress resilience through the interaction with GABA, which is, again, so everyone knows, the primary inhibitory neurotransmitter that, keeps us calm and reduces anxiety. And so we have that. And then estradiol as well. It has a negative feedback mechanism on the HPA axis. So we've got these two sex hormones that we've just been told serve fertility purposes, when in fact they play such a system-wide role in helping the body cope with stressors, all kinds of stressors. And when we're losing those, and then also we're experiencing what I feel is this sort of midlife stress that only really happens at this time in our lives, which are small children or teenagers, depending on where you're at, or you have aging parents who maybe you need to take care of or help with. Your career is usually right at the very top, or you're really in an upswing, or maybe you're even switching careers. And then you've been married or in a relationship for probably a long time at this point. So there's potentially problems there too. You've got this unique life experience happening. And I feel like it's almost a perfect storm. And of course, women are like, what is happening to me right now? So I think that is something that is really grossly overlooked.
I think so too. And it's really interesting because I think this has been something that's happened to women in this age group for a long time. And it's been labeled different things. I think about like the Mad Men era, like the 1960s, like women staying at home and they would be given benzos and, it's like mommy's little helper, right? Through that time, where I think now we have our eyes open. And there's a lot more dialogue and discussion to the juggle and to the multiple challenges that women carry. But it hits at that time of life where you're going through this tremendous hormonal change. And it is the perfect storm. There's no better way to talk about it.
Yeah, for sure.
I want to talk about one more potential stressor that can happen at this time that I want to make sure women are aware of, which is people think that once these period changes of perimenopause stop, it's the end of their fertile window. But of course, we've all heard those stories of women who unexpectedly conceive, even if they thought they were menopausal. They haven't had a period in months and months. From what you've seen, is that really the case? Like women in their 40s still ovulating, still getting pregnant naturally? Is this something that we should be thinking about?
Yes, this is such a great question. I love this so much. And I think the short answer is yes. Many women in their 40s continue to ovulate and conceive naturally, even during this perimenopause window. Obviously ovarian reserve and egg quality is on the decline. There's no doubt about it. But fertility does not shut off with, the first sign of irregular cycles. Perimenopause, as we've been saying, is this window in which things begin winding down, but it's really not that we have a system shut down that so many of us are led to believe that it is, that's happening. It's this transitional phase. So things are fluctuating, but there are fertile windows. As you said, right? We'll have this one great ovulation and there are real chances of pregnancy. Again, they're a little less common, but I think the CDC talks about, in terms of stats, well over 100,000 women a year in that early 40 range are having children. And that doesn't even include miscarriages or pregnancies that aren't carried to term. So I think that we really have to shift this idea that we are just falling off of this hormonal cliff and that this one size inevitability that once we turn 40 or even 42, that our chances of conceiving are just null and we are not going to be able to have that baby. I think that this narrative is really flawed and it causes a lot of unnecessary fear and shame, especially if we've been taking care of ourselves in that preparation and that lead up to our 40s.
Yeah, you're absolutely right. And now there's actually so much interesting research happening on like rejuvenative and restorative therapies for the ovary, like stem cell therapies, PRP, things that are really, they're seeing actually helping reduce ovarian aging or even reverse ovarian aging to get the ovaries to produce a follicle. And that's getting more technical. That's more of an IVF type of environment. But even natural fertility, like you said, for women who've cared well for themselves, it can happen still during that time.
Right, totally. I feel as though we don't have to just refer to the stats or defer to the stats. We can really consider that there is enormous biological variability when it comes to fertility, and chronological age is not the same as biological age. So we have to be really taking a much more personal approach.
Yes. So let's imagine these women who've gotten pregnant in perimenopause and now they're going through this additional change in their life. Maybe it was wanted, maybe it was a surprise. We don't know. But, pregnancy, like, does going through menopause add any layers to pregnancy of like what's happening hormonally or even emotionally?
Yeah. Right. I mean, when you think about sort of just the mental and emotional piece of things, first of all, I just, want to say that women who are in this place right now, I just want to say you're not alone. Your desire to conceive later in life is valid. It's worthy. It's deeply human. And I think
Absolutely.
that, right, we hyper focus on the biology of fertility, especially for women, even though men are contributing to half of this, and we're not really looking at them the way we've looked at female fertility. And then, of course, we're hyper focused on the biology of it, but we're overlooking the emotional and the mental weight that comes with trying to conceive in your late 30s or your 40s, especially if you've entered into that perimenopause window and you're having symptoms and things are changing and your identity is literally changing. So I would say that when we're going through this, the emotional terrain of pregnancy is so full. And then we layer that on top of perimenopause. And I think it creates a very unique experience. And, you're going through this whole body recalibration from a pregnancy perspective and a perimenopause perspective. And so your brain, your mood, your metabolism, your stress resilience, all of this is affected. And so when you're pregnant during this time, I feel like it's like riding two major hormonal roller coasters all at once is what it feels like. And then I think, one of the biggest things is the progesterone. So as we've said, that's a key hormone in perimenopause and pregnancy. And so that has been declining potentially, but then we have huge levels, a huge increase during pregnancy. So I always think about during pregnancy, typically women do okay. And then it's the postpartum where it's just a more significant crash. And so that's really where I think the self-care during pregnancy and the taking care of your physical health and your mental and emotional health is so important.
I'm really glad you bring that up because it is such a challenge. And the older you are, like the more likely you are to have nutritional deficiencies after pregnancy. Like that self-care during pregnancy and just healthcare during pregnancy becomes so much more critical when you think about things like your blood sugar balance through pregnancy, your energy, your iron status during pregnancy, all the things that women of any age who are pregnant have to think about, comes up even more biologically. And then also the impact on kind of social, emotional health in pregnancy. Are your friends going through the same thing as you are, or do they have younger children already? Or even at work, like the impact of being pregnant at work when you're working a busy job at the prime of your career. There can be so many different layers that get mixed in there.
I was just thinking that actually as you said that, I was thinking there are so many layers and there's also so many fairs as well, where I feel that we should probably all be in therapy, just working through all that stuff or talking through it with somebody, because there are these inherent fears of miscarriage and how you're going to manage parenting in midlife. I think all of those feelings are really valid. And I think that there's just a lot of emotional complexity that we don't want to push away during this time.
Yeah. I always thought, because this is the largest patient population that I've always had in my practice, women 35 and up that were trying to conceive. Because usually it came to me after IVF failed and they were looking for something else or something to do with IVF to be more successful. This is a group that I've worked with for quite a long time. And I think one other point that I always like to call out for anyone listening who's in this situation is that there are so many benefits to you and your children if you have kids late in life. In fact, there's women who are who give birth later are more likely to be to have pursued higher education. They're more likely to read to their children. There's all these statistics on the way you parent, and that probably comes from life perspective. Like you think about, I mean, I won't put it on anybody else. If I got pregnant at 25 versus 35 versus 40, my life experience was very different in the way that I mean, you still have challenges no matter what age, but the way you think about parenting absolutely would morph with your own life experience. And I think your kids can benefit from that sometimes when you have children a little bit later. There's also health benefits like reduction in certain cancer rates and things like that for women who conceive later on in life versus those who don't conceive at all. So it's not always a bad thing.
Yeah, I love that you said that. I agree with that. I feel like there's so much to celebrate about becoming a parent later in life. I really do. And we don't talk about this nearly enough. And I would say what you were saying is that we're stepping into motherhood with a deeper sense of self, essentially.
Oh, I love the way you word that. Thanks for making that better.
Yeah, no, I agree though. I agree with everything you said. I feel like a lot of us have done this inner work, or at least we've attempted to, and we've built these careers or these passions. And I think we've developed this emotional maturity and intelligence that makes us a lot more grounded and thoughtful as parents. Not that you're not, if you're in your 20s and 30s, I don't want to dismiss that by any means, but there is really something to be said for coming into this at a later stage.
Yeah, definitely.
Yeah.
Well, Nicole, I'm really grateful for you coming on the podcast today. I was really looking forward to talking with you in this episode. I know I'd shot you an email beforehand because I was really looking forward to meeting you, and it didn't disappoint meeting you. We've talked about all kinds of things from starting your period to normal periods, abnormal, and now through fertility. Let's call it geriatric pregnancy, because I'm doing air quotes right now because I think that's the funniest term that we give to women. I think it's over 35 who conceive these days. And just the impact that it has on us as women. But, you know, I want to end by just saying that I've always admired your work from afar, because you really bring in the biology and helping women be more attuned to this part of their bodies that's been scary, mysterious, hidden for so long, but also the way you bring it forward with the sense of advocacy and self-advocacy. So thank you so much for the work you do and for being with us here today.
Thank you so much, Jacqueline. Wow. I feel like I have just started my day in the best way possible. I appreciate you saying all of that so much to me. And I'm so grateful for all of the work that you guys do at Dutch. This test is a game changer. And I'm just really glad to have that tool in my toolbox for sure in this work that I do.
Fabulous. Well, thanks for joining. And thanks to all of you for listening today. If you want to learn more about Nicole and her work, Nicole, what are the best ways for people to get in touch with you or to learn more?
Yes, you can go to fixyourperiod.com. I have a detailed period quiz on there. You take that and it'll take you to a dashboard where all of your responses are populated, very beautiful imagery so that you can understand exactly what I've been talking about today with regard to what's going on with your menstrual cycle. And I'm also on Instagram at Nicole M. Jardim. And yeah, that's about it for the most part.
Fabulous. And if you liked what you heard today and you want to hear more from Dutch Podcast, we have great guests on every week. We launch a new podcast every Tuesday, and you can join us. And I encourage you to follow us wherever you stream your podcasts, and make sure you're following us at Dutch Test on all of your social media accounts, because we always post awesome clips of our guests and all the newest information coming out, including a course that we just launched on perimenopause, which we're talking about right now. So hope you check that out. Thanks so much for joining me. We'll see you next week. If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.